Good evening. I'm Hampton Mayor Donnie Tuck, and I'd like to thank you for joining us this evening for our discussion, COVID-19 Aftermath, Addressing Mental Health. Over the past 16 months, we've used these broadcasts to update you on Governor Northam's latest executive orders and their effects on the City of Hampton's operations as well as its business operations. We provided statistics on the number of cases in our city, the average number of cases within a 7-day period, and a month-to-month comparison. We also noted the individuals and groups that seem to be most affected. We provided information on testing as well as vaccination, such as which groups were eligible for the vaccines and vaccination sites. Tonight, with many of our COVID-19 concerns almost in the rearview mirror, we thought we would use this Facebook Live to look at one more challenge presented by the disease, its effects on mental health. And that is the reason we've assembled this special panel of healthcare professionals to address your questions about COVID-19 and how it has impacted you, your family, or your community. Tony Crisp is the Director of Addiction and Recovery Treatment Services at the Hampton Newport News Community Services Board. He's held leadership positions in both physical and behavioral health care. Good evening and welcome, Mr. Crisp. Dr. Bruce Copeland is Coordinator of School Social Work Services for Hampton City Schools. He's also an adjunct professor at Norfolk State University School of Social Work. And Elizabeth Betsy Clark. Ms. Clark has been an advocate for children and families with complex needs for over 25 years. She spent 14 years at the Hampton Newport News Community Services Board, serving in a variety of roles, and she's presently with the City of Hampton's Child Services Act Administrator in the Department of Social Services. First question, separation from loved ones, loss of freedom, boredom, and uncertainty can cause a deterioration in an individual's mental health status. I found a report that stated nearly 20% of COVID-19 patients develop a mental health issue like depression, anxiety, or dementia within 3 days of diagnosis, according to a new study. And so these are almost separate situations. One talks about individuals with COVID-19, and the other just talks about the separation is caused by so many of us having to quarantine ourselves. So I guess would anyone like to address this issue about the separation, the anxiety, and the loss of contact with each other?
I can go first. Again, my name is Tony Chris. I'm with Hampton Newport News Community Services Board. I first want to say that we are open, and we have been open since the epidemic, and I do want to give some critical numbers if I could. First of all, if you want to write these down, it's very important. We have a warm line for people that may be impacted by COVID-19 or just impacted by the outcome of COVID-19. And that's our warm line is staffed by peers. That number is 757-251-2394, 757-251-2394, and it's staffed by peers. The peers are people with lived experience with mental health or substance use disorder. We also now, if you feel the need for mental health services or substance use disorder services, especially dealing with the anxiety and depression from COVID-19, we have what we call rapid access. Initially, we were providing that during the COVID. We were providing that through a telehealth, but now you can walk in and get a clinical assessment by a licensed therapist for care. So if you have any anxiety or depression or probably using drugs or alcohol because of COVID-19, you can walk to our building at Building 200 Medical Drive in Hampton. And then, of course, if you experience a real crisis, not a real crisis, if you experience a crisis, the number is 757-788-0011. And I wanted to say that because during the COVID, many folks, those that needed our services, thought we were closed. So we did a lot of advertisement promotion with our stakeholder to let people know that we were not closed. And we did receive words from some folks that they were depressed. Our warm line was very effective in reaching out to people. And sometimes we got phone calls from the same person over and over again because they couldn't cope with the COVID. So it was a variety. People dealt with it in a variety of ways. Some of it had to do with work crisis because their work environment didn't, how should I say, didn't practice the CDC guidelines, so there was concern about that. So we had a lot of experience with those kind of issues. I'll let somebody else speak at this point. So.
I would like to offer that everyone in this country was impacted in some way by COVID-19. And as it relates to children, children depend on a stable environment at home, in school, and in the community. And to the degree that adults are stable and able to provide that type of environment and support them, it has a direct impact on children and their ability to cope with grief and stress. Although children are resilient as it relates to many things, they're not miniature adults. So when adults suffer and when adults struggle to cope and adapt, it has a direct impact on children. So quite naturally, we've seen children who have dealt with issues around anxiety, being worried, being fearful, dealing with things around grief and loss as a result of this pandemic. And I could go on in describing the various things that have impacted them. And many of our families, parents were tremendously impacted. Again, they are the source for the stability in the child's life. And when a parent loses employment, they lose housing, sometimes they lose their ability to cope, and they also lose their ability to manage their own frustration. And as a result, it can create conflict in the home with the child. Now, with the loss of school, that's even a more significant impact, because often when we've experienced trauma or some type of unexpected event, we try to return to what we define in our own mind as being normal. And school is such an important aspect in a child's life. It's such a form of stability and normality that they rely on. So when schools closed and children were at home all day with parents who were struggling, parents who felt frustrated, and even if they didn't feel economic frustration, they felt the frustration of having to be the teacher to their own child. And that may sound nice. However, under this pandemic, we found out that it's much more difficult than any of us had imagined. There have been technology gaps for families, children who live in poverty, although many of our children have suffered, but children who live in poverty, children who represent a disadvantaged demographic, suffered even more. If you have means, then you were able to get the computer you needed, you were able to get the Wi-Fi connection. But if you were living in impoverished circumstances to begin with, this pandemic and this absence from school really caused a tremendous adverse impact on the lives of families and children in particular.
And thank you, Dr. Copeland. I actually have a number of questions and concerns I'll ask you later about children, and particularly school children. Ms. Clark, though, I had a conversation with Wanda Rogers, who's Director of Human Services, and I asked her if there were clients of hers who she knew who were having impacts from COVID, and she said yes. In fact, she knows of individuals who wound up going to the emergency room. So can you tell us a little bit about that, please?
Sure. What we know is that prior to the pandemic, mental health and behavioral health resources were not plentiful. There have always been, or there in recent years, there has definitely been a decline in resources available. And so with the pandemic, it certainly escalated that need and that demand. Where that results, a lot of times, very frequently, is the emergency room. When people don't know where else to go, they frequently go to the emergency room. And so some of the current studies, we know that there's been almost a 40% increase nationwide in children under the age of 18 showing up in emergency rooms, seeking mental health and other levels of care. And so when we talk about the clients, a lot of times the customers that we serve, not only they show up in the emergency rooms for those mental health and behavioral health, but in our population that is homeless, that is very frequently where they end up. Generally any kind of resource deficit, and they end up there, and it has left our healthcare providers in those places overwhelmed with not just the treatment of COVID patients, but also all of these other societal impacts in that, and that is the increase in what those issues have been.
Thank you. And we have with us tonight Robin McCormick, our communication strategist. And Robin, you're going to be manning the Facebook just to find out what comments and questions are. So just want to find out if there have been comments and questions posed for our panel tonight.
We have viewers, but we have no questions at this point. And I think one of the things is, this is a tough topic because a lot of people are reluctant to even ask questions. Like mental health or needing that kind of help has a taboo still to far too many people. So, we're going to fill in with some questions until people feel a little bit more comfortable, if that's okay with you guys.
Well, I want to go back, and what started me thinking about the impact on, I guess, our youth and particularly school children was back in April. There was a panel during our National Youth Violence Awareness Week, and one of the panelists there talked about just trauma and just different things that occurred as a result of COVID. And now we recognize the school environment provides stability and structure, but one article I read talked about, I guess, attaboy, attagirls that come from the staff. It's that encouragement that also was lacking during that time away. So we want to talk about, I guess, that environment and how its impact on our young folks.
Yeah, I will speak to that. I will tell you that we all can agree, and its support for this statement is that school is the safest place for children to be other than home during the day. So school provides a kind of stability and support that most people can rely on and trust. And with that gone, it can create tremendous problems. Also, school not only provides the instruction and the academic support that children need, but they also provide the mental health support. There's research that will support that 57% of children, adolescents in particular, who require mental health support, they get those needs met in the school building. We have a lot of mental health agencies around, but typically most students get their mental health needs met at school. And those who don't get them met at school, many of them, won't get them met at all. Especially for those, again, who are lower income and those who are disadvantaged. Typically, they may not have the means to get that mental health support. So yes, encouragement, feeling valued, feeling safe and protected, they get those needs met at school as well. So it's not merely academic support, it's the emotional support that they get. And once COVID-19 caused the closing of schools, they were without that. And then children who had already had mental health concerns, they were exacerbated by their absence from school. Some didn't have them and began to show signs of having concerns. Some already had mental health concerns that were made worse by being absent from school. So with the counselors, the social workers, the psychologists that are employed by the school division, typically we're able to identify those children and support them throughout the year. But with their absence from school, many of them we may not have known about, and we're not able to provide that support.
Well, and I want to follow up on that. Darla also asks, I read a study that showed that depression increased, among the entire population pretty dramatically. And I thought, we have seniors at home. They're not able to go to the senior center. It's going to be worse for them. No, it was a dramatic increase for teenagers. And I look back and think, who did I care about during my teenage years? Was it being home with mom and dad? No, might have been going, out to events. Now, how did that impact even the people who are relatively mental healthy at the time to have that kind of isolation? And then also, what resources are there for teenagers? I think each of you maybe could speak to that a little bit.
Well, at the Hampton Newport News Community Services Board, of course, we provide a variety of services, both on the mental health, both for adolescents and children. We have a large program for adolescents and children, and we were open during that time frame. Of course, many of the school programs were not, since there was no school on site, we did a lot of things therapeutically through telehealth. But one of the studies I found, this was published by the Department of Behavioral Health, and it came out in April of this month, April of this year, and it was entitled COVID-19 Impact Report 2019 to 2020, and it said that major depression diagnosis increased tremendously among both adolescents and adults, so children and adults. So, as well as that, suicide was up. Was overall inconsistent, but this time last year, they had 110 suicide, and they really, a part of that was due to COVID concern. Also, one of the surprising statistics or data that came out of this publication was that the percentage of people starting substance abuse disorder treatment, more people went to treatment, believe it or not. But on the one hand, that's a positive, but at the same time, there was more drug-related deaths. It increased by 84%. And you count alcohol was part of that whole process. A lot of alcohol-related crashes. So in addition to mental health disorder, there was also a lot of fatal alcohol as well as drug-related deaths. And then, of course, SAMHSA on a national level said that black folks nationally have experienced the greatest increase in the rate of overdose death during the pandemic from synthetic opioids. So it impact a lot of people. The way they deal with being depressed is to drink more. And then it was easy during the pandemic to drink, you know. That didn't close, so and so of course you had those alcohol-related crashes. So you drink, you take more pills, and those kind of things. So I think it's really eye-opening.
I would say when you talk about particularly adolescents, and I appreciate Tony sharing those statistics because we've seen a lot of that as well. When you think about school, it is just part of the education, the academics, the structure is just part of it. For a lot of our youth, their entire social network, their social fabric of how they identify themselves is connected to school, be it through activities, sports, all of that connectedness. And so when we look at how do we get those resources back out to young people as things open back up, there has definitely been, I would say, a kind of a snowball effect of those mental health symptoms. And so even though some of those activities have returned for our young people, we are seeing that they are still experiencing those very high levels of depression and anxiety, substance use, all of those things that we don't want to see an increase in. And so one of the things that we've done, which is what we always do, and it's critical, is we have to get information out there. How do you access those resources? What are those resources? The city has a tremendous amount of resources available to young people and their families to be able to access behavioral health and mental health resources. But how do you contact them? How do you get them? What are they? And that's why that information campaign is really critical. What are the resources? How do you get them out there? We clearly have contact information out there available. Not everyone is going to meet the criteria. Some of our programs are specific to that. I appreciate Tony sharing those numbers, those phone numbers, because those are really critical. And I think we have been looking at systems across our systems. How do we coordinate and make sure that families and young people are getting access to those? Because for some folks, an outpatient therapist might be the primary level of need. For some of our young people, they have a much more complicated presentation. They're going to need much more complicated services. But that's a starting point, and that's where we start those referrals and assessments in those contexts.
I found this study by National Alliance on Mental Illness, and in it listed several different things, and I want to go back to what you said. And this study was from Lancet, Mental Health Effects of School Closures During COVID-19. And it said for some children with depression, there will be considerable difficulties adjusting back to normal life when school resumes. So the question is going to be, what was the challenge that once you're back in what should be that structure, why is there a problem adjusting to what you define as normal?
I know in the Hampton City Schools, I want to say what a great job they've done in terms of reacting to the pandemic. It was a very abrupt matter that we did not expect, but they acted responsibly. They followed the science in their decisions to close schools and to support children who were learning remotely. One of the excellent things I think that Hampton City Schools did is that every child in the school division received a Chromebook in order to be able to access the instruction that was being done remotely. Every child. That was not the case prior to the pandemic. And also even things like a hotspot. So if they were at a location where they couldn't get good Wi-Fi, the school division did that. Also providing breakfast and lunch to students all over the city. Even while they were not in school during the entire school year, Hampton City Schools was able to do that. And in response to the return to school, Hampton City Schools have hired additional employees. I've received additional employees through my office to help us prepare for the students who may return, who may have mental health needs and challenges. We've devoted several staff people in our office to provide mental health services full-time throughout the division to students. That would be their only responsibility. The school psychology department has received additional employees. So what we try to do is to increase our human resources in order to be able to meet the need, and recognizing the importance of school-based mental health counseling for our children in general. In general, that should be there. But now with COVID-19, school divisions all over the country are recognizing the need to have this mental health support put in place. And again, I want to bring you back to the statistic that says that of the children who need mental health services, 57% of those children will receive those services from school. So it's important for us to have the human resources accessible to those children during the school day, not necessarily just the weekend or in the afternoon, but during the school day.
Well, I need to ask you, because school was closed, you know the students that were having challenges prior to the closure. Were you referring those students to some other source for the treatment for the care and support that you were normally providing during the school day? And now, Mr. Crisp said that people thought they were closed. Mm-hmm. So it almost suggests that those individuals who needed that assistance during the course of the school day may or may not have been getting it from CSB. Mm-hmm. And so how were these youth getting the services that they needed during that period of closure, or were they getting any services at all?
Well, they were getting some services, of course. We always strive to do better. The pandemic was something that we had not expected. So in reaction, we tried to increase the support that we were able to provide. One of our closest relationships is with the Community Services Board. So usually that's the first stop. If we can't provide those services during the school day in the school building, the team that we rely on most frequently is the Community Services Board. Outside of the Community Services Board, we try to connect them and link them to a network of providers who are in the private practice arena. Also, one of the valuable resources that we've used before has also been something called in-home counseling for students who are eligible, where the counselor actually goes to the home. The staff in my office were charged with having a caseload of families that they would check on, to monitor, to see what the needs were. These were our most disadvantaged families, because we had to triage, for a matter of speaking, we had to triage. Because of the limited human resources, we had to prioritize those who were in the most need. One of the groups of families that we really targeted were our homeless families, our displaced families. They're the ones who typically have the most trouble with attendance, maybe, because they're really mobile in terms of their housing issues. Many of our families had housing, but lost it. Thank goodness that we had the moratorium on evictions for those families. So that helped us to be able to help them. Once we had them connected to the appropriate technical support in terms of a Chromebook and those sorts of things, we were able to do, I wouldn't call it telehealth, but we were able to call in and have a visual connection with them around what was going on in the family. But really what we really needed to provide for most of our families was to make sure that their basic needs were taken care of. And the lack of attendance to the basic needs can exacerbate whatever mental health problems they have. If they're not eating, if they don't have adequate housing, that creates a tremendous problem. So if we're able to address the basic needs, then we can reduce some of that mental health, some of the mental health issues that they might have.
I just want to add, though, initially, yes, people thought we were closed, but we did a very good job to make sure that people knew that we were open. And our youth division, they saw an increase in the number of folks, and they have what they call an urgent care, so people can just be seen on a daily basis. Of course, initially it was through telehealth, but now you can see people face to face. But I would just want to make it very clear that we had to do a lot of promotion initially to let people know that no, we were not closed, although we were providing some service through telehealth. Most of our medical services, seeing a psychiatrist, they still were seeing face-to-face, or say in one of our medication assistant treatment programs, they were still being seen face-to-face, but many of the therapy sessions was done by telehealth. But we did a very good job to let people know we were open. I would like to say our youth services division did see an increase in the number of people served, just to clear that up.
I just wanted to add too, and it touches on a little bit about what Dr. Copeland and Tony had shared. A lot of the ways that we got those young people served is we also have in some of our Title I elementary schools, we have social workers that are employed by the Department, family services specialists that are employed by the Department of Human Services. And one of the things that we did in coordination with Hampton City Schools, in coordination with the Community Services Board, is made sure those young people, we tried to get all of the information out there in whatever platform that could be utilized, whether it was our technology, whether it was phones. We did do some home visits to ensure those families were served. And because we recognized a lot of those families are known to us, a lot of those young people and their families have always been known to us. And so we ensured that those young people that we were connected to, we were continuing to make those connections to. We continued to provide services in any format that we could, be it telehealth. We still had providers in our community that were doing direct service provision, with restrictions, of course, even in place, but recognizing that mental health needs, those unmet mental health needs, are just as essential as a physical health need. And so we knew that we could not take our entire system and close it up, even in the midst of a pandemic.
Well, I just wanted to follow up on something the mayor said about, getting to the aftermath. That mental health is a big, scary term, and it encompasses a whole lot of things, but people who experience depression or anxiety during this, it's not the same as the blahs. And when your job comes back, or when you go back to school, you're not magically better. I mean, so how do you help people, and not just kids, but people through that transition, and to realize, especially if you've started drinking heavily, you're going to find you can't really function. So how do people get their lives back? What can they do?
Well, again, the Community Services Board provide a variety of services, both on the side of the addiction services as well as mental health for both adults and youth. And we're available, and people can walk in for services. They don't have to make an appointment. If they feel like they have a problem, they can walk in. Again, I want to give you some three numbers. One is our warm line. Say if you're not ready for treatment just yet, but you have somebody to talk to. That number is 757-251-2394. And this warm line is staffed by peers, people with lived experience with both mental health and substance use disorder. Again, the rapid access, if you want to call them, you can call 788-0243, but you can walk in, no appointment. You will be seen by a licensed therapist, and they will do an assessment and then refer you on to services. And this is both on the adult side as well for people, young people. Again, with the young folks, we also have an urgent care center. And then if they have a crisis, of course, we have our crisis number, 788-0011.
Tony,
Also with-
I believe you're forgetting one of the key things about the Community Services Board, which is you see people regardless of income, regardless of insurance
Right.
status, or anything else. That's huge.
Yeah, and that's, I was going to say, and we do have some, major grants that we receive, fortunately, especially if people have an opioid use disorder, that they don't have to pay a dime, not even a sliding scale for services. So that's good. Thank you for that.
You know, I think, Mr. Mayor, one of the things is to awareness on the part of the people entrusted with our children and with the community. There was a segment of people who didn't even believe that COVID-19 was a real thing. Okay, so we're past that now. So when our children return to school, we have to be aware that these are real possibilities, that these children may come back and we may witness some things that we didn't see prior to the pandemic. So just awareness on our part, preparation, and again, like I said, the increase in human resources that we've committed ourselves to in the school division is going to be helpful, and the training that we receive as we approach the opening of school. And as much as possible, to keep things normal, to keep the environment to be safe and nurturing. And relationships matter. You know, children need to know that they're safe and that the adults who are with them every day really do care. And through those relationships, we will be able to identify children who may not be adjusting as well as we would like to see them adjust. And when that happens, we have to have a system in place to assess the needs of that child and provide the support that that child needs. So I think that Hampton City Schools, in a sense, their eyes are wide open as it relates to what we anticipate might be the challenges when students return.
Well, you touched on some points, and I know Ms. Clark is preparing to respond to something. So I'm going to put this out there for all of you. And I've got a nice little list right here because I did some research. But how would a parent recognize that his or her child is experiencing some of these mental health concerns? What are the outward signs of it that would alert a parent to say, whoa, this perhaps is a little less than normal?
I think one of the things that if a parent is looking and trying to see whether their child it's just a normal blah or an adjustment, there are some things that we always look at. We look at changes in behavior. What are those changes in behavior? Are we seeing young people that are with an increased need for sleep or a decreased need for sleep? Are they eating more? Are they eating less? Are there other behavioral changes that you see? Are they isolating themselves more so than they normally did? Do they have the same attention to their personal care and their hygiene standards? Do they want to still talk with friends and families? Do you see an increase? Depression can look differently in an adolescent than it can in an adult. Do you see an increase in anger or frustration, their ability to manage those emotions? Those are all signs that we're looking at. Those are all indicators that it might be want to be a conversation that a parent has with their young person, or to take that young person and have a professional assess them. Those are some of the ones that we're looking at. Not all of our young people will verbalize that. They show us by their behavior a lot more frequently than they do by their words. And so those are some big indicators for us that we're looking at.
Well, Dr. Coler, I thought you were prepared to respond as well.
I agree with everything that Ms. Clark said. Those are the telltale signs of depression. We're all trained to be aware that when we see those signs that some action should be taken. Of course, nothing in isolation means a whole lot, but collectively, when you see those symptoms exhibited in an individual child over some period of time, then you can be pretty certain that there's a need for some degree of intervention with that particular child. I do know that when children do return to school, one of the things we have to be prepared for, because there's a link between academic success and mental health. And this COVID-19 has caused students to lose a lot of instruction and lose some of the things that they've learned over time. Some students were fared well in the pandemic as it relates to its online learning process, and some students didn't do well at all. Some did not log on, some were not able to access the instruction, and therefore they've fallen behind. So a couple of things that we can do when they return is that Teachers are always the first responders in many of the things that children face. So the relationship with that teacher is very, very important. The nurturing, the support that a student receives from that teacher is important. The other thing that's going to have to be done is that we're going to have to take a look at differentiating instruction. You know, trying to identify what the needs are academically, who's falling behind and by how much, and what we need to do to differentiate that instruction so that those students can get caught up. School failure is a source of depression for children. Children want to do well. They want to please their parents. Contrary to popular belief sometimes, they do want to please their parents. They want to be accepted. They want to earn good grades if they're capable of doing it. So we have to create multiple paths for them to demonstrate what they know and for them to find academic success. And that directly correlates with their emotional well-being. If they're doing well academically in school, they may even feel better. And if we help them meet their basic needs, they feel even better.
Well, now I have an observation, and I think we just went back on the hybrid system in March. And so now, April, May, June, a little more than 2.5 months, I suppose, you're back with a summer. So you're back almost to that same thing of isolation and perhaps loss of structure and routine that you were into for just a little more than 2 months. What kind of impact will that have, or is it too early to begin to assess what the impacts might be?
I think once they return to school, it's like most things in our lives. We have a difficult challenge or the loss of a loved one. We get back to work. It helps us in many instances to get back to a normal routine. We are going to see some challenges for certain students when they come back. But the best possible scenario for our students is for them to be back in school, in person, learning in the traditional manner. And then we address hopefully the small number of students, we hope, that have unique challenges, and we help them to get their needs met. Most of our students, in fact, are gonna thrive, I believe, when they return, when that environment is normal. Now, I'll tell you how some of the depression had manifested itself with school children. We might not think it's important, but the whole ideal of not being able to have a graduation in the traditional manner, that's a small thing to us. It's a huge thing to those students. Not to be able to have a prom, not to be able to attend a football or basketball game. Those kinds of things, once they're back on track with that normal routine, we're going to find that it's almost like what we call the tiered system of support. With a good program for our students to return, 85% of our students will do well at that first tier, just by providing a basic level of support for all children. Then we might have a few children at that next tier who might not do so well and they need additional support. We usually can work with those students in small groups, etc. They do well at that level, but we may have a small percentage, maybe 5% of our students, who may need the individual support, who may need the professional counseling, but the majority of our students are going to thrive, I believe, when we return to in-person learning, and we're all aware of the challenges and we provide the support.
And I'll also add, I think it is a little early to tell, but I think that what we are expecting is a continuation of some of the challenges that we've seen. We have seen in our systems that serve young people and their families, we have seen an increase in the number of referrals for services. Again, those young people that end up in the emergency rooms. All of our behavioral health serving agencies are seeing increases in referrals. We are seeing increases in our social services world, in those connected to sometimes. You'll see an increase in child protective services complaints. And so there's a lot of those systems where we are seeing increase in need and demand. And so I think it will be a continuation of that. And if I could just tie into that, one of the things when we talked a little bit about why when those structures are returned, we will see a lot of young people when those structures return. We will see them improve and make those gains. But when you've been through a trauma, you carry that with you. You're not the same person coming out of that trauma that you were going into that trauma. And so those are the things when we talk about those symptoms and how we do it, as scary as that sounds, really how we intervene is just providing good assessment and very targeted intervention to meet those individual things. If your young person isn't eating, if your young person has a sleep disorder, if any of those things, we treat that. There are resources available to serve all of our young people, all of our families in our community. And so that's how we get back out there and learn to live with the trauma and move beyond the trauma.
All right, this is a really hard one, but she's asking for your opinions. Ruth wants to know if you all see a connection between the increase in isolation, the lack of structure, job loss, and the rise of violence in our teenagers and young adults.
Anyone want to do first?
I think that in the summertime, where we see a lot of the increases, it is not unusual without that structure, when you add every one of those factors that you tend to see an increase. As a community, we're constantly trying to evaluate and how to intervene in that. We have seen nationwide an increase in violence, and an increase in those. Our community is not unique in that. Those definitely we have definitely seen those as contributing factors. It's not the sole source, but it is definitely does not help in our intervention of it. There is a lot of unstructured time. There has been a lot of challenge, and when you lose hope and you turn to different ways to structure yourself. And so I would say it certainly, I think it can be an impactful factor in what we're seeing in our community.
I don't know how much of it could be linked directly to COVID-19, but I can imagine that there is a correlation to some degree. Employment is to parents as school is to children. And when parents lose employment because of a pandemic, they can't meet the family's basic needs. That creates a tremendous amount of stress on the entire family. So behavioral dysfunction, however it's manifested, even with the parent or the children, could be linked. So I think that mental health certainly is important, but when the mental health condition is, when the etiology of it is environmental in nature, that the environment caused the depression, that we have to fix the environment. And if we can employ people who became unemployed, we can see the decrease in the depressive symptoms if we can find them employment. Because ordinarily they may not be depressed, but having lost a job could depress nearly anybody who depends on that job to meet their basic needs. So I think that if we have children who are in the community, not conducting themselves as most parents would like to see the children conduct themselves, it could be a lack of supervision. It could be that the parent themselves are too depressed to be emotionally available to their children. And that's another factor. When parents are suffering, and even if they can meet their financial obligations in that way, if they are stressed, they're not emotionally available to their children in the way that children need their parents to be. And that absence of emotional availability could create delinquency in the community among children.
So this is a really common theme on this thread. It's Diane, Ruth, Darla, Ellen. And I'm going to relate it to something the city manager frequently says. We are staffed with our public health system, Virginia Health System, to deal with the kind of day-to-day. And when something huge happens, we realize that there's not enough funding there to vaccinate the entire peninsula for a staff that's used to vaccinating children prior to school. Is there an issue with funding of mental health services? And does this sort of point a big old finger at that problem?
Well, you know, funding's been a problem with mental health services for a long, long time. You read it almost every day across the state in different newspapers about the psychiatric hospitals, the state hospitals. You know, there's no rooms. And then, of course, many of the private sectors also will not take anyone. So there is a problem with a lack of resource, both on the mental health side as well as the substance use disorder side. However, I think we have an opportunity now through some additional funding from the federal government to look at some of the infrastructure. So hopefully that will help. But part of the problem is that, like all other industry, is human resources. Sometimes you just can't find the right people, or they want more money. And so it's nice to have the funds, but then it's going to be a challenge to find the human resources to provide the services that we need, in addition to building the expanding children's services. We're fortunate that Children's Hospital will have a larger inpatient services for children, but we just, is in addition to having the funds, we just have to find the human resource, and sometimes that takes time. It's going to take time to build the infrastructure in terms of human resources to deal with that.
I think funding is always an issue. There is never enough when it comes to this level of need. We had shortages in mental health. Funding is a critical thing. But there's also a part that policy plays into that, not just in the funding. One of the things that we have seen in the pandemic is, with changes in policy, we can use resources differently. And examples of that is we had some waivers that were granted to allow insurance companies to be able to bill telehealth session. We had waiving of copays, and so that wasn't a barrier to seeking treatment for a medical or mental health treatment. We also have issues reciprocity with licensure. When you have a licensed mental health provider, perhaps you have a provider in another state that is able to see you, but if their license isn't recognized in our community, they can't do that. And so funding is part of it, but how that policy ties into that funding is critical, because we've seen some windows of opportunity during this, and where we can use the resources that already exist, but we can use them differently, or we can push the envelope and broaden the envelope of what we can do with those resources.
We've actually talked a lot about children and young people. And Ms. McCormick talked about seniors earlier, and I want to go back to seniors. And I want to go back to them because, from my own perspective, I think there are certain populations that they have to have that social interaction. And, we closed our rec centers, so individuals weren't playing cards, and they weren't doing those things at the rec centers. And then churches. A lot of churches did online services, and I just believe that a number of our seniors, for them, church was that whole thing of the fellowship, and it was support, and it was network, and whatever else. How has COVID-19 impacted our seniors and older population that you perhaps have observed?
I would say it's had a tremendous impact for the things that you just mentioned. Definitely church. For seniors, for many seniors, church is their social network, one of the most important social networks outside of their family. And to not be able to assemble with people that they know and care about on a regular basis, I'm sure, has exacerbated what's already known to be a high level of depression among seniors anyway. I don't think people really recognize that the senior population is a population of our community who struggle with depression. Some of it has to do with the fact that they're aging, health problems, and the loss of friends. I have an elderly parent, of course, and the number of friends that have passed away, lifelong friends, that's almost a natural part of aging. But then when you add the pandemic to it, and you take away their support network, which is the pastor, the congregation, their friends, their organizations, definitely. And then to have to be isolated and living in fear around being part of the most vulnerable population. You have children on this end who we say children are generally okay for now, we thought. And then you have the most vulnerable population, people with pre-existing health conditions, the aging population. So they probably were living in the most fear, scared to leave their homes, believing that if I just went to the supermarket that I could contract this illness and die. And then if you don't have responsible people in your life, children, other young people, people who love and support you that could do some of those tasks for you, you had to venture out to do that yourself. And I can imagine that it might have been very, very scary for our senior population.
Also, a lot of them don't use the technology. I mean, I recall it just the technology, and I've never been on Facebook before. I don't want to go on Facebook. I don't know how to do Facebook Live. I don't want, or texting a friend about, how do you do this? It's just, it's very confusing to them. Yes, isolation. But now many of them are afraid to come back to church. Often, I found in my church, many of them are afraid. On the first hand, the first thing they want to know is, when is church going to start back? And then the ones that wanted to get back together are not coming. They're afraid to come. So there's that ambivalence on their part about, I want to be there, but I'm afraid to come because we don't know this thing. We're not out of the woods yet. I mean, that's what I hear sometimes. So.
All right, well, let's throw parents into the mix, because right there in the middle, even if you were lucky enough to keep your job and to be able to telecommute, you might have been dealing with an aging parent and groceries on at the same time you were trying to do your work and help a kid through, or multiple kids, get through that day's schooling and do that day's homework. I mean, they have been, even the luckiest ones have been really pulled and stretched and pushed.
I don't think there's anyone that can say that they were stress-free during the pandemic. I don't think anyone can say that. I think that we all experienced some stress to a more or lesser degree. But definitely you describe what we call a sandwich generation, is that I'm raising children, and then I'm also responsible for aging parents. And I can imagine being in the middle of that is probably one of the most challenging places to be. And on top of that, if the parent was only responsible for making sure the children had dinner each day, that might not be such a bad thing. But the big part of it was that they had to monitor their children receiving virtual instruction and feeling as though they failed because they couldn't help their child in the way they wanted to help their child. And if their grades reflected it, they might have personalized a lot of it and blame themselves for certain things that they really didn't have control over. But I can imagine that part all by itself is probably why I've heard the most concern. When are these children going back to school? I can't do this every day, was what I was hearing most. And from parents who were in the worst circumstance, it was about, I don't know if I'm going to be able to pay my mortgage or my rent this month because I lost my job. Those two situations seem like to me to be the worst for many people.
Well, so what do schools do, either this summer or in the fall or on a longer-term basis, to get those kids caught up? I mean, some kids were able to weather the virtual learning better than others, and some, are in danger of kind of falling off the cliff there. How do we get that? I mean, the Hampton school system has been phenomenal and has one of the best graduation rates, fewest dropout rates. I mean, there's been all these huge gains, and now how are we going to sustain that and get back to where we were?
Right, and prior to the pandemic, all schools fully accredited without condition, and all of those things that you just mentioned, is because of the hard work of the administration, those teachers who are the first responders in the classroom. I think that what Hampton, again, is going to be prepared to do is to create awareness among the people who have to be there for the children. We can't assume that normal means that we don't change anything. We have to change our approach. And I want to go back to something that I mentioned before about how we view things in Hampton as it relates to behavior and instruction. We approach it from a tiered system of support. So we generally try to provide a level of support for every single student in the school division. And if that support is applied consistently with fidelity, we generally are able to help the vast majority of children to achieve academically and behaviorally in school and emotionally. Where there are a few students that don't fare well at that very basic level, then we increase that support for that small number of students. And by the time we implement it at that level, the very top level, we implement something more direct. That's probably the students that we're going to target. We have to have a system for triaging concerns, because everybody doesn't need the same amount of support. There are some who need it a lot more than others. So those students that come up to the top tier in our system to triage those students will receive the most intense support. They will receive support from school social workers, school guidance counselors, school psychologists. And where we're not able to meet those needs, then we're connecting with our friends and partners at Community Services Board and also at Social Services. When we identify that there are parents who have needs that the social services system can help them with, then we link them to those services as well. We're in the buildings every day. We see these students. We're the ones who see them first, and we know what their needs are. So our job would be to address them wherever and whenever possible, right there on site in the building. And then where we can't, to make sure we link them to the appropriate services in the community. And the representatives from CSB and the Department of Social Services are probably our most reliable partners in that effort to help children and families.
All right, we have addressed children, we've talked about parents, we even touched on seniors, college students. And I have another one of these reports. It was a survey from the National Alliance on Mental Illness. So the impact of COVID-19 on student mental health, 20% of college students say their mental health has worsened. Now, perhaps we don't see it as much here because Hampton University has a lot of students who come from outside of our community. So some may have been here, some may not have. You've got students at Thomas Nelson. A number of schools were closed and had just virtual learning. Did we find these students showing up at CSB or seeking, care someplace else?
You know, I don't have those numbers with me. I don't know. I know we serve both young adults as well as older adults. I'm sure a few of them did show up to our site. Again, there was a lot of people with depression as well as substance use disorder. I don't know, but again, many universities, of course, they were doing virtual too, and they were doing it. Even if you went to, say, Christopher Newport, you may have done it at home, and if you live in Virginia Beach or you live in Alexandria, you went to those kind of CSB or services or private sector. So I wish I could have the answer for that, but I don't have the answer.
Many campuses have on-campus counseling programs. The university where I teach, they definitely do have an on-campus counseling program, and it's my understanding that they did see an increase in that. Many of those students, some of the students on campuses across this country and in the Commonwealth are students who are homeless, and that their college dorm room is their home. And provisions are often made so that they can stay on campus during the summer and during various breaks during the year because they have nowhere to go. Also, there are international students who can't just hop on a plane and go back home because school was shut down when they were expecting to be on campus for a semester or two. So definitely, it was a disruption in what was normally thought of as a campus environment or college experience. It was a huge disruption. And I also say that as a parent of 2 college students, that it was a huge disruption. Again, your family support, your support system can get you through a lot if you have a good support system. But we know that some people don't have the stability of a good support system, and they have to rely on services. So just as I said about the school, within the school we have to have a robust school-based mental health counseling approach because we see them every day. College campuses also have counseling centers on campus to help students with their concerns right there, and they don't have to go across town looking for that support. One of the things about mental health support is making it convenient for people to receive it. We can talk about having a program But if people don't know about it, or if people don't find it convenient, some of our people rely on public transportation. They may not be able to get to an appointment or get to an appointment on time. So if you're using public transportation and your appointment is at 4 o'clock and you get there at 4:30, you may not be seen because you didn't get there on time. So wherever and whenever possible, when we can bring the services to the people, it's better than having the people have to come to us at various locations that they can't get to. So that's why I'm a big proponent for school-based mental health services. If you have a college, you need a mental health counseling program on your campus so that people can access it more readily and more easily.
There was an issue about churches being forced to close and ABC stores being open. And you've talked about alcoholism and just the number being high, or the use of alcohol being high. This is for instance, a supposition, but can you begin to even offer why ABC stores were open? I mean, I heard a report once and it talked about because people do have an addiction to alcohol, that you had to have those places open. Otherwise, you might have encouraged some other kind of acting out or abuse within the family or whatever. But I'm just curious, and I'm not asking you to be the governor at this point, but I'm curious about why ABC stores would open. It couldn't just been because of profit motives.
Well, I did hear about what you just said about the issue of a lot of people with alcoholism, and they needed that medication. But I just think it was a revenue-driven. That's personally, I'm thinking it was revenue-driven. You know, they needed the funds, and the other part to that, they didn't want to make people very angry. But substance use was a major problem during this whole pandemic. I haven't shared out some of the numbers that I noticed that even within our area here, in terms of opioid use disorder and the number of people that OD during this time frame, it's just locally we had last year over 456 people suspected of opioid overdose, and 66 of them died from overdose. And this quarter, January through March, we had 98 people suspected of an OUD overdose, and 19 people died.
Let me ask you, when you're saying that you're talking about in Hampton,
both
Newport?
Hampton and Newport News.
Oh, my.
Yeah. We had over, and I got this from our local law enforcement departments, in 2020, we had 456 people suspected on an opioid overdose, but we had 66 people to die. And this year, from January through March, we have 98 suspected overdoses of opioids, and 19 people died. And it's continuing to get higher. So it's not only alcohol, but it's all these other people coping with the pandemic through other means, too. So.
I'm going to ask you, and when we were doing the statistics on COVID-19 cases and which groups were more susceptible to getting COVID-19, we talked about demographics, and Black Americans were more likely. I have at least one study here, and it actually looks at university students, and it said that NBC News and a group called Challenge Success, which is affiliated with Stanford University, conducted a nationwide study last fall, reported that 56% of all students reported an increase in stress during the COVID-19 pandemic. Black and Latino students showed an even higher rate at 63%. And so when we talk about, again, the effects of pandemic on mental health, is there a group that has shown a higher susceptibility or higher numbers than other demographic groups?
I would say absolutely. One of the things that the pandemic has done is it has exacerbated disparities that already existed across our systems. And so our young people, really across age demographics, we absolutely saw communities of color much more negatively impacted by the pandemic, not just the physical, the health aspects, but also the behavioral health aspects, the economic aspects, all of those things cumulatively, it just was exacerbated in those communities. Those things already existed. In what it did is it highlighted it and certainly increased the demand and the need that we've seen.
The raw numbers as it relates to the data surrounding deaths speaks for itself. Then there are other pre-existing health conditions that African American population or people of color are disproportionately impacted by, such as diabetes and obesity and some other things that were considered high risk factors for not surviving if they ever contracted the disease. So definitely I agree with Ms. Clark around it exacerbated already known disparities among people of color.
And at the same time, these folks are harder to reach to get into services. And it's hard to encourage them to come to services. It's hard to educate them about the services. And so they get the other end of it. They have the great impact because they're very hesitant about coming in for services, or it's hard to find them. And so one of the things that we have to do is really have to re-engage in many ways with all our stakeholders, first responders, the faith community. We got to really re-engage now with all our stakeholders to find to help those that we find hard to reach from a public agency. And one of the things I noticed from this community service board perspective, we depend a lot on the criminal justice system, especially probation and parole, especially as a director of substance abuse disorder, of addiction disorder, is that we saw some of our numbers go down because there was no, the probation and parole office, they didn't, I guess the enforcement was reduced. They were doing telehealth either, so they didn't make these visits to people's home. So a lot of folks did not get connected to treatment. So it's a hand-in-hand kind of thing. So we're dependent a lot on first responder, and we have to work with our churches and other community groups to let people know that we're all available to help folks that need our services.
I was going to summarize a question that Darla asked and that Ellen asked, sort of lessons learned from COVID, some of which might be good, as Betsy mentioned, bending rules for insurance companies. But how can we teach our children or our grown-ups to be more resilient so that when bad things happen, they cope better with it? Is there a way to be more proactive with mental health in schools or anywhere else? And where do we go now? What have you learned?
I think those are all great points of what we've learned. I think building resilience, we know that helps insulate you from the worst effects of physical and behavioral health challenges. And so how do we build that resilience? I think those lessons learned are that there's a lot of ways that we can do that. I think we've learned that when everything is stripped away, what is the most valuable for families, for individuals, for communities. And so building that resilience, being more proactive about our mental health, not waiting until there is a crisis to intervene and to get help for that. Integrating that. I love what Dr. Copeland continued to say about integrating that mental health care. That's one of the places into our schools. That's a place that we know all of our young people are at. And so when you build that and kind of take that stigma away at a very early age and a very early intervention, it becomes a way of life, and it helps build that resilience. And so when difficult things happen, you're much more readily able to cope with that. I mean, that's what we're doing in these lessons learned. We know that there's populations and groups of individuals that we have to pay special attention to. We have to target our outreach probably even more so. We've learned that. We knew they existed, but the degree to which they were there and they needed our resources and our assistance, we've learned that. And so going forward, when the stress of the pandemic recedes, taking those lessons learned and applying them to make sure that at the next crisis, which any community will face, that we're in a better position.
You know, they're predicting that we may have another pandemic. It was predicted that at some point we would. I think President Obama talked about it, a pandemic and being prepared. And so we had one, and we should not assume that we may not have another pandemic. It's taught us a lot of lessons. It really has. And I would say that rather than to talk about what went wrong, let's talk about what went right and what we can do to make things better. One of the things I say about resilience when it comes to people is that resilience we don't teach resilience by doing everything for them. We empower them so they can do it for themselves. So we have to arm them with information to be able to be advocates for themselves, because it's more people who have a need than there are people to help them with their need. So we can't just do everything for everyone. We have to empower them with information. The other thing I would say is to embrace the technology. What it's taught us is how we were behind in our thinking about technology and our use of technology. I was on a call once, listening in, not participating, but listening in to a group of HBCU presidents of universities. And they were talking about how the pandemic showed them how many students who were on campus enrolled in college were behind with the technology. Some did not own computers. It's unbelievable to think that somebody's in college but doesn't own a computer. They also talked about how the faculty was behind on the technology. And when it came time to teach using that technology, everyone panicked. They didn't know what to do. So what I would say about the technology is like you're not going to be able to unring a bell. It's here to stay. So rather than be frightened of it, we should embrace it. And what I also learned is that some students may do better on a computer at home. That should be an option for those students. Some may do better under those circumstances. That's one of the things that we discovered, that, hey, Johnny did a lot better. But we also understood that some students didn't do well at all. So, and then the last thing I would say again, school-based mental health services. It's a lot better when we bring the services to people rather than have them to come to us. The faith-based community can be an ally, because I know in the African-American community, typically the faith-based community teaches us how to pray. You have a problem, you pray. Let's continue to do that. But let's also talk about how it is also a good thing to seek professional counseling for your serious mental health conditions. And if the faith-based community is in concert with the professional community around mental health, we're going to get more people engaged in the mental health process and getting their needs met that way.
I had one more question, but it's approaching 8:15, and I think actually the question about lessons learned was the ideal endpoint for our conversation. So I want to thank each of you for your participation tonight in our discussion of COVID-19 aftermath, addressing mental health. Dr. Bruce Copeland, who's coordinator of school social worker services for Hampton City Schools, and also an adjunct professor at Norfolk State University School of Social Work. Tony Crisp, Director of Addiction and Recovery Treatment Services at the Hampton Newport News Community Services Board. Elizabeth Betsy Clark, who's an advocate for children and families with complex needs for over 25 years and currently employed by the City of Hampton's Department of Human Services. Thank you very much for being our panelists. To Rob McCormick, our communications strategist, thank you for your questions and for fielding things on the Facebook Live. Thanks to Brian Marchese, who's always assisting us in getting our program on the air. And thanks to the Channel 46, 47 team for their works behind the scene, and thank each of you for joining us. We are hopeful that this is our last COVID-19 Facebook Live, but you never can tell. But again, have a great evening, and thank you very much. Bye-bye.